So the UK and Ireland opening, I like to think, for new opportunities. Let's demonstrate that to you. What I want to do is just in 10 minutes or so is walk through the data with you so that you have all of the facts. And at the same time, try and decipher the politics that's happening around all of this. And hopefully by doing that, we'll be able together to look at where the opportunities lie for you to get a piece of the action from the UK. So starting first, I'm not sure how this is, there we go, because it's in PDF format. Firstly, you probably all know that the UK has been rolling out the vaccine very well. We're proud of the way that the NHS has dealt with the rollout of the vaccine, putting us in the top 5 nations in the world in terms of those with a population of at least 1 million. So the data as of last week, we were in 5th place there. And what it really means significantly is that over 88% of the UK population now has COVID antibodies. And we're working really hard on the 12% to try and get them vaccinated as soon as possible. So it's a fantastic achievement and one that we want to capitalize on. But obviously there are some barriers in the way, which I'll come to. Our vaccination status, these are the latest figures that were published last night at 6 p.m. and give you the figure up to the end of June. So more than 44 million people in the UK have received a first jab of the vaccination, one of the leading nations in the world. That equates to more than 85% of all adults, and 2/3 of the entire UK population have been jabbed. In terms of fully vaccinated with a second vaccination, more than 33 million people. So 2/3 of all adults are now fully vaccinated. And by today, by the end of today, it will be half of the total population, obviously including children. So it's a significant step forward in terms of ensuring that the population is totally vaccinated today. However, though we have really successful vaccinations, we are seeing rising case rates. And this is what's putting the block for many countries on opening up to the UK. Let's dig down into this a little bit. So yesterday's figures reported at 6 p.m. were almost 28,000 infections. It is, I acknowledge, very high. If you look at that compared to the second wave, which yesterday's figure was about as bad as it got in the second wave. Look at the figure there around November. We had a similar type of number, around 28,000. However, the difference between the first wave and the second wave is that our death rate is much lower. So look at where we are today, 22 deaths. That's actually a relatively high figure. We've had death rates in the last 2 months going typically from 1, we've had days when we've just had 1 recorded, to around 12 or 13, 14. So 22 is a relatively high, but not unusual figure. We have had those figures coming through before. Significantly though, look at November last year when we had similar infection rates, and you will see that our death rate was running at around 440 deaths per day. So deaths are significantly lower. And what the UK government is saying is they believe that the link between COVID infections and high death rates and hospitalizations has been broken by COVID vaccinations. Now, why are we seeing such high increases in cases? The reason is, as you all know, the Delta variant came into the UK in May. Shortly afterwards, on the 19th of May, the UK effectively came out of lockdown in many ways. We allowed more interaction, clubs, bars were able to open, people were able to mix, including within households, within units of 6 people. So inevitably there was interaction amongst the community. Most people who've been vaccinated have been unaffected by all of this and by the Delta variant. Not all, because the vaccination only gives you 95% protection, but the infection rate has been driven by those predominantly who've been unvaccinated, and mostly That's people who are aged under 30. And I know this because currently my daughter is one of these people. She's just been infected this week. And the other side effect of that is that we have to self-isolate. People have to self-isolate. Luckily, I don't, because my daughter lives in Manchester. But people around her now have to self-isolate, and it is affecting the economy of the UK. So the government is keen to get people under 30 vaccinated, and anybody over the age of 18 can get a vaccine in the UK right now. And over half of all people under 30 have now been vaccinated with a first vaccine, and the figures are going up daily. So that's the situation. Our death rates are low, our case rates are high, but it's mostly in the unvaccinated and in the young people who are able to fight off the infection much easier than the older and more vulnerable population. So our hospitalization rates are quite low. A quick word about Ireland before I move on. In Ireland, the population is 5 million people. 1.5 million of those are already double vaccinated. Currently in hospital are around 45 people and 15 in intensive care. Now, unsurprisingly, because those numbers in terms of hospitalizations are low and the number of people vaccinated is increasing, Ryanair, the chief executive, Michael O'Leary, this week called for Ireland to be opened up to travel. It's important to us because that's the major airline in Ireland now, and it serves a number of destinations in the Balkans. And also yesterday, the German health minister, Jens Spahn, said that the Delta variant, which we're seeing dominant in the UK, will be dominant in Germany within just a few days. So he believes that the current bans on most travellers coming from Britain and Portugal, where the Delta variant is endemic, will be lifted very soon. So there is a number of key dates in moving forward in the UK and within Europe. And I've put some here which have happened in the last week, just so that you've got the full data, and things that are happening in the coming month, so you can make appropriate plans. The first one is the 23rd of June. So last week was the Travel Day of Action. You may have heard about it in the news. Basically, there were protests across the nation by people who worked in travel, and it was across all spectrums of travel. So we had airline pilots, cabin crew, travel agents, inbound tour operators, outbound tour operators, and a number of other suppliers to the travel trade all took part in this day of action with a march on Parliament. Those who couldn't attend did other things. I couldn't attend because I was in isolation because my second son had COVID and he lives with us, so we had to self-isolate. So I wrote to my member of Parliament, I wrote to the BBC, wrote to various newspapers, and met up with the travel agent locally on Zoom here. The effect of this was to put travel at the top of the political agenda, and a number of actions have happened as a result of this, significantly on the 24th of June, the next day, which I'll come on to. But since the 23rd of June, travel and overseas travel has rarely been out of the news. So on the 24th of June, the first action that happened post the Travel Day of Action was the green list was expanded, and that came into effect at 4 a.m. on the 30th of June. Now, Abby, who's looking here from Jacobs Media, was actually one of those people who took advantage of this, because the announcement was made on the 24th of June to expand the list to include key honeypot destinations. So they would be Madeira in Europe, Majorca, in fact, all of the Balearics, Malta, and a number of destinations in the Caribbean. So it does allow travel agents to start selling key destinations. And I mentioned Abby because on that day, you changed your holiday plans. You should be in Croatia and Slovenia next week, but you were one of those people who, as soon as that was announced, booked a holiday and you're going to Menorca next week. And Abby's very typical. So I was in the travel agents in my village, and within the 1 hour that I'd been in the travel agents, he received 5 requests for these green list destinations. And the plan is to expand this. So people think we're closing down in the UK. We are not. We are expanding the opportunities for people to travel, and the government is keen to increase this green list as much as possible. Now, We operate a traffic light system. So there's the red list, which is definitely a no-go. The green list, where you don't need to quarantine when you come back, although you do have to do PCR tests still currently. And then there's the amber list, which are all the destinations that are being watched. All of the Balkan destinations are on the amber list currently, even though you all have much lower rates of infection than we have. So there's a big push to get all of the amber destinations turned to green within the next few weeks, and certainly in time for the summer holidays to begin here in the UK. So even though we have the amber list, and you're not encouraged to travel there, it doesn't mean you can't. And I know people who are traveling to the amber list destination. So a friend of mine told me yesterday his father has just come back from North Macedonia. He's now isolating, and he's furious because he can go to North Macedonia, but under our legislation, he can't meet his grandchildren. So we have these crazy anomalies which people are fighting against now. And my sister is traveling to Greece with her husband on Monday. And all those people are thinking, okay, I've got to isolate for 2 weeks, but that's a price I'd pay in order to get some sun after 16 months of effective lockdown. Now, next date, 19th of July, the key one. This is when the UK and Ireland reopens. In Ireland currently, the hospitality industry is kind of in lockdown. Indoor hospitality is not allowed yet, even though it is in the UK. That's expected to change on the 19th of July. And here in the UK, particularly in England, it's anticipated that all social distancing measures, including mask wearing, will be stopped. All the venues which are currently closed, including nightclubs, for instance, will be allowed to reopen. Sporting events, music events, any event, any conference will be allowed to happen with full numbers. So the Premier League, for instance, is anticipating that it will be able to reopen in August with full stadia. And this is a massive step forward for us in terms of our reopening, and it's really part of our vaccination bonus. And finally, the 26th of July is actually when the summer season begins in England. So we're not like the rest of Europe. I know I said at the start, 1st of July is really the kickoff point for many of you. Here, the season starts on the 26th of July because that's the first Monday when the schools, the state schools here, are on holiday. In Scotland, it's different. They're already on holiday, but here it begins the 26th of July. So there is still plenty of time. And if Abby is a case in point of somebody who books last minute for a destination that's suddenly announced on the green list, expect if the Balkans gets put on the green list prior to the 26th of July, that on that date or very soon after, you'll start to see British tourists coming, provided you let them in. And that's the key thing that I'm going to cover next. So we do have some challenges. These are the ones that were raised by our Transport Secretary this week, Grant Shapps, in terms of opening up. Number one is, how will children be considered? I can tell you that this week, Pfizer was approved by the UK government for under 12s, well, actually by the regulatory body for under 12s in the UK, although there is yet no plan for vaccinating school children, although the government is looking at how that can be rolled out, because obviously when they go back to school in September, that will be the vulnerable sector in terms of spreading the virus. So that is on the agenda. Number two, what happens to people who cannot or will not be vaccinated, he said. Well, many EU countries, as you know, will accept prior infection and proof of that and recovery as proof of antibodies against COVID. And the NHS app is designed to deal with that. And I know that the European Green Certificate or COVID certificate has the same things in there to recognize people who've had COVID within the last 180 days. The third thing, how to recognize people's vaccination status at airport, is not something that I anticipate will affect the European destinations, particularly those who are using the European Union certification. He's really here driving at the American market, because in the USA, the states are responsible for issuing vaccination certification. And there are 50 states, and quite possibly there are 50 different ways in which this vaccination is being certified, some with apps, some with paper, and some with certificates that are very easy to forge, and how do you, as a border control person, recognize the 50 different methods that they operate in the USA? So there isn't any central standardization there, and other countries have similar challenges. And that's really what he's driving at there. I don't think it's something that will affect Europe particularly. And as a result of that, I think we've got huge momentum going at the moment, particularly with regards to the NHS app and EU digital certificate having mutual recognition. So our app, I have mine, but everybody has it now, does show what the vaccination certificate status is, with the numbers of the vaccination certificates that I've got. If I have tests, it shows up on there too. And it does also show if you've had prior infection. And it's pretty much the same for the EU digital certificate. So there are a lot of noises at the moment about the two bodies, the government and the EU Commission, being very close to an agreement to recognize each other's technology, and to show, so that we will be able to travel within Europe, and Europeans will be able to come to the UK because our systems are aligned. It's not just the government and these bodies who are talking about it and the press. Jet2, for instance, the local airline to me, but it's also the largest airline flying into the Balkans from the UK. The CEO, Steve Heapy, said this week he's working with the government to achieve this mutual recognition, which will enable people to travel to countries quarantine free, and that will massively open up tourism across Europe. According to the Times newspaper, who produced this yesterday, the UK ambassadors in Europe are being asked to lobby the governments there very strongly to persuade them to lift restrictions on British holiday makers, particularly those who've had 2 vaccinations and can demonstrate that they are COVID-free. And we expect announcements in the UK on Monday, and then following that over the next few weeks, looking at the green list and new destinations being added to the green list. And the government themselves have said they want to have the bulk of this in place for when schools break up on the 23rd of July. Now, the border technology. Does the border allow you to travel with these apps? Yes, in the UK it does. So the company behind the technology, the eGates, has said this week that they have technology in place that will allow the scanning of vaccination certificates digitally and in paper form from both the UK and the EU. And I mentioned paper form because some countries don't have this technology. Malta, which has just gone on the green list here, is only accepting British travellers if they've got the paper certificate, which we can easily print off from our app. We've got a new health secretary in the UK, you may have seen in the news. I won't go into the reasons why we have one, but the good thing about him is that he used to be the culture secretary. So he was responsible for tourism in the UK. So he totally gets where we're coming from and what we need as an industry. And he's very data driven. In the last week, he's made very positive noises, virtually saying that the 19th of July date is going to be the date when restrictions will be lifted. And he's very positive about opening up the borders to those people who are double vaccinated and removing the need for quarantine. So we expect that that will drive a lot of momentum leading to this opportunity. And finally, I just want to look at vaccination dividend, because the public really want to take advantage of the fact that we are double vaccinated. And they're saying, if I'm fully vaccinated, why do I still have all of these restrictions? Why do I have to self-isolate if somebody I come into contact with has COVID? We want all of these restrictions to be removed, and some of them may be removed even before the 19th of July. Now, I know that the vaccination only gives you 95% protection against COVID. And in Ireland, they've just produced a report showing, I'm saying these are the bodies who advise the government, showing a mapping that with Delta endemic, that they've got 500,000 people aged over 70. 5% of that would be 25,000 people. And that would mean potentially over the winter, 25,000 people who are vulnerable could be hospitalized. Now, we know this. but the feeling now within the UK is that we need to capitalize on the 95% protection that it gives us and learn to live with the 5% risk. And this has been spearheaded by our former Prime Minister, Theresa May, who said in the Commons on the 10th of June that 20,000 people a year die of the flu, and the government needs to be very honest with people about this. And we have to start learning to live with COVID. And those are the types of noises that are coming from the government now. So we are looking at opening up. We are looking at aligning everything with the European Union. We are looking very seriously and working with the European Union to open up travel to those people who've been double vaccinated or can demonstrate antibodies through testing or through previous infection. And the mood within the country is to open up and get rid of all of the restrictions which are in place. And things are happening now, such as the Euros and so on, which are giving people a great positive feel. So the mood is not negative here. The mood is positive, and we're driving things forward. And I fully anticipate that by August, all things being equal, that we should be seeing large movement of UK people traveling abroad. And that, I believe, is the opportunity. And that, I think, is what we need to capitalize on. And what we want to bring you in the next few presentations is ways in which you can work with us to capitalize on this opportunity in the UK. Sorry, that was probably a bit longer than 10 minutes, but there's a lot of things happening at the moment that I really want to bring to your attention. Anyway, thank you. If you've got questions, because of time, just email me. That's my email there. I don't think we can take them now. Thanks very much, everybody. Bye-bye.
Thank you. All the best.